In my capacity as the Alma chair, I have come up with a 4-point agenda to help us get back on track to end malaria in line with the AU catalytic framework. My priorities towards this end are, firstly, enhancing digitization and the use of real-time data, including through using and sharing country malaria scorecards, so that all citizens are aware of the malaria situation, which will improve decision-making and also empower our people. Secondly, to engage with regional economic bodies in Africa to advocate for heads of state and government to address key challenges and to provide solutions in the fight against malaria. Third, creating end malaria councils and funds to boost high-level multi-sectoral engagements and advocacy at country level, while increasing both public and private domestic resource mobilization. And fourthly, launching an Alma youth army to engage existing youth leaders across the African continent to champion youth engagement and resource commitments for malaria elimination. The Alma Youth Army will promote innovation, research, and development, and also create a cadre of malaria advocates and champions across our continent. Ladies and gentlemen, since I established these targets in early 2020, here in Kenya, we have launched our malaria scorecard, and at the same time, we launched our Zero Malaria Starts With Me campaign. We also launched on World Malaria Day our Kenya Alma Youth Army. This to enhance the engagement of our young people in the fight against malaria. We have launched our Kenya End Malaria Council and Fund to keep malaria high on the domestic agenda and to mobilize additional resources against this fight. I'm happy to report that in Kenya, we have now reduced the prevalence of malaria from 8% reported in 2015 to 5.6% this year. The number of confirmed malaria cases has also decreased from 113 per 1,000 persons to 86 per 1,000 persons. In addition, the proportion of patients and with malaria seeking outpatient treatment and services has reduced from 30% to 19%, while inpatient admissions have also decreased from 20% to 15%. Even as we in Kenya have reason to celebrate our achievements in the fight against this disease, we are fully aware that Kenya is not an island and mosquitoes know no boundaries. Therefore, we on the African continent must harmonize our efforts, constantly share information, and ensure that no region is left behind. And it is for this reason that during the February 2021 Summit of the African Union, I launched the Alma Scorecard Hub as part of my data digitalization agenda. The Scorecard Hub is an important resource for enhancing the use of real-time national and subnational data for greater transparency, accountability, and evidence-based decisions. Countries are already sharing their scorecards on this site, and I also encourage all my colleagues to follow suit. I also call on my fellow heads of state and government, ministers, parliamentarians, business executives, and community leaders to join me in supporting all actions towards ending malaria on the African continent. I set a target of establishing country-led end malaria councils and funds to boost domestic malaria financing in 15 countries by the year end 2021. Our recently established Kenya End Malaria Council was simple and quick to set up. Availability of local resources is the one way to ensure that we sustain our gains and continue to make successes in this fight against malaria. I want to take this opportunity to thank Eswatini, Uganda, Zambia, and Mozambique, which have also followed suit and established such councils, and I look forward to the formation of these funds in more countries across our continent. Your Excellencies, ladies and gentlemen, in 2020, I was asked to chair the Africa Leaders Malaria Alliance. I accepted that honor, recognizing that we cannot achieve the African Union's ambitious Agenda 2063 without first strengthening our health systems and redoubling our efforts towards fighting both communicable and non-communicable diseases. Ladies and gentlemen, if we do not address malaria and take decisive actions to eliminate it, we will continue to see more deaths from this easily preventable disease. Our health systems will continue to be overwhelmed, and our social economic agenda will be derailed. Ladies and gentlemen, the African Union has recognized this. In the AU catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030. Over the last 2 decades, 1.2 billion cases of malaria and 7 million deaths have been averted on our continent. Nevertheless, malaria remains a significant threat to Africa's health and development agenda. According to the World Health Organization's World Malaria Report of 2020, the malaria incidence rate in Africa has plateaued since 2015. Africa has not yet achieved the 2020 target of reducing malaria incidences and mortality by 40%. And this, ladies and gentlemen, underscores the challenge of achieving the goal of eliminating malaria by 2030. Malaria knows no borders. Our regional economic blocs, that is the East African Community, IGAD, SADC, ECOWAS, and the Economic Community of Central African States, offer the best platform for cross-border collaboration and joint resource mobilization against malaria. Strengthening cross-border collaboration with subregions will accelerate implementation of high-impact strategies towards eliminating malaria by 2030. We must see synchronized efforts across border regions of our countries and have better information sharing. I call upon the economic blocs to take a very keen interest and invest in efforts to eliminate malaria. Anti-malarial efforts will have a high return on investments in terms of saving lives and increasing the productivity of labor and its contribution to the overall social economic development agenda of our continent. The economic blocs should also consider a reward system for countries that will achieve best results towards the reduction of malaria cases and deaths. Your Excellencies, ladies and gentlemen, there is no doubt that so far our collective progress has been significant. But the war against malaria is far from won. Let us all redouble our efforts and learn from one another. We must all resolve to accelerate progress and to continue our commitment to combating malaria in order to achieve national, regional, continental, and global malaria targets by 2030. Zero malaria on the African continent starts with all of us as individuals. Our regional economic blocs must endeavor to provide the necessary support to countries with a focus on communities at high risk of infection. Africa's renaissance will remain a dream if we do not invest in our youth who constitute 60% of our continent's population. It is in this context that I also launched the Alma Youth Strategy during the Africa Union Summit held in February of this year. The strategy provides a framework for engaging youth across Africa to develop a continental Alma Youth Army for malaria elimination and to drive youth contribution to the broader health and development agenda. The vision of our plan is to encourage our youth across Africa to advocate and drive action towards malaria elimination and the expansion of universal health coverage. Our mission is to provide a platform to build a Pan-African movement of young people involved in the fight against malaria and other health challenges through advocacy, communication, and evidence-informed action. Approximately 109 million people living in the 6 countries of the East African Community, 394 million people living in the 17 countries in West Africa, and 186 million people in 10 countries in Central Africa are at high risk of malaria infection. Each year, in Southern Africa, there has been an overall decline in the malaria burden, but the objective of eliminating malaria in 4 of the 8 SADC countries has yet to be achieved. Now, more than ever, we need to strengthen our surveillance and ensure that 100% of suspected cases are tested and all confirmed cases are treated. We need to ensure universal access to malaria case management, including at the community level, through expansion of our community health worker networks and sustaining our vector control interventions.